Hi everyone, welcome back to our channel. Today I would like to clarify some frequently asked questions about Medicare. In this video, I will discuss what is Medicare, what are various parts of Medicare, how much does it cost, what is covered and what is not covered by Medicare, and the difference between Medicare and Medicaid. So what is Medicare? Medicare is health insurance for people 65 or older, people under 65 with certain disabilities, and people of any age with end-stage renal disease. Now let's take a look at various parts of Medicare. Part A, which is hospital insurance, covers your inpatient care in hospitals, skilled nursing facility care, hospice care, and home health care. Part B, which is medical insurance, covers services from doctors and other healthcare providers, outpatient care, home health care, durable medical equipment, and some preventative services. Part C, which is Medicare Advantage Plan, works like a health maintenance organization, HMO, or a preferred provider organization, PPO. It includes all benefits and services covered under Part A, and Part B usually includes Medicare prescription drug coverage, Part D, as part of the plan. It is run by Medicare-approved private insurance companies and may include extra benefits and services for an extra cost. Part D, which is Medicare prescription drug coverage, is designed to help cover the cost of your prescription drugs. It is run by Medicare-approved private insurance companies, may help lower your prescription drug costs, and help protect against higher costs in the future. Medicare is not free. Medicare premiums, deductibles, coinsurance, and co-payments for typical medical services must be paid by the policyholder and should be taken into consideration when estimating medical expenses in retirement. So Part A, hospital care, hospital insurance, typically there is no premium charge for Part A for most of the people if you've worked and earned enough credits in your lifetime. There is an annual deductible and additional charges for hospital inpatient care though. Part B, which is again medical insurance, the premium varies by income and it is $134 a month. This is for year 2018, but this amount changes every year. And it could be higher depending on your income. There is also an annual deductible and typically there is a 20% copay. There are various options that can help you manage these deductibles and coinsurance. Feel free to reach out and we will be glad to help you navigate the Medicare supplements or Medicare Advantage plans. Part C, Medicare Advantage plans. These plans charge additional premiums and copays vary as well. Part D, Medicare prescription drug coverage. This plan charges additional premium based on your income and choice of plan. There are deductibles and copays also vary. Medicare does not pay for everything. Medicare doesn't cover everything, right? So if you need certain services that aren't covered under Medicare Part A or Part B, you will have to pay for them yourself, unless you have other coverage, including Medicaid, to cover the costs, or you are in the Medicare health plan that covers these services. Even if Medicare covers services or item, you generally have to pay deductibles, coinsurance, and copayments in certain cases. Some of the items and services that Medicare doesn't cover include most dental care, eye examinations related to prescribing glasses, dentures, cosmetic surgery, acupuncture, hearing aids, and exams for fitting them, and long-term care. Note, if you need help with coverage of the above items, please feel free to contact us and we will be glad to help you. Medicare is not Medicaid. Medicaid is a joint federal and state program that helps with medical costs for some people with limited income and resources. Medicaid also offers benefits not normally covered by Medicare, such as nursing home care and personal care services. Each state has different rules about eligibility and applying for Medicaid, so check on that. I hope this information was useful to you. We have a few other videos on this topic. Please feel free to check it out. Also, if you haven't subscribed yet, please consider subscribing to our channel as well as liking and sharing our videos. Thank you.